Well, good day, everybody, and welcome to the Psychological Disorders edition of 5 Minute Psych. In this 5-minute segment, we'll ask the question, what is abnormal? And in doing so, we'll first recognize that there's a lot of variability in what's considered normal or abnormal. Then we'll look at the 4 Ds as a way to define abnormality. And finally, we'll tackle 3 issues with diagnosing psychological disorders. Asking what's abnormal is really the same thing as asking what's normal. And as you can imagine, there's a lot of variability here across individuals. Some of us like to skydive. Others wear crazy face paint to go to a football game. And a few of us talk to ourselves. Not only do we see a lot of variability across individuals, but also across cultures. In our North American culture, we'd see it as abnormal to enjoy being chased down a narrow street by bulls or eating chocolate-covered ants for a light snack. But elsewhere, these things are perfectly normal. So you see, it's not easy to come up with a single definition that can cover all the bases for what's normal. Although there isn't a single definition of what's abnormal, many psychologists refer to the 4 Ds that we'll look at in just a second. But know that having any one of these Ds doesn't mean that you have a psychological disorder. And it's more that the more of these Ds that are present in any one person, the more likely it is that they have a psychological disorder. So, the first thing you'd look for is deviance, when the person's thoughts, emotions, or behaviors fall outside of what's considered normal in that culture. But having deviance alone doesn't mean a behavior is abnormal. For example, most of us don't talk to ourselves, but if we did, we wouldn't be considered to have a psychological disorder. The next D is distress, when the person experiences an intense emotional reaction that's out of proportion to the situation, like feeling severe anxiety or depression for something that most of us would consider minor. Keep in mind that sometimes distress is a normal reaction to a situation, and lack of it can also suggest a psychological disorder. Another characteristic of a psychological abnormality is dysfunction, when the person's thoughts, emotions, or behaviors are interfering with their ability to function properly in their daily lives. They can no longer go to work, run a household, keep things clean, pay their bills, do their shopping. And finally, danger, either to oneself or another. Although it isn't often that a person with a psychological disorder is dangerous, it isn't a characteristic that you'd want to overlook. Keep in mind that danger alone doesn't mean abnormality, as many of us skydive, downhill ski, and scuba dive, and that's just for fun. There are certainly advantages to diagnosing a psychological disorder based on a set of common symptoms. If different disorders can be defined this way, then it's possible to start looking for causes for these symptoms, and then to go even further and look for treatments. But there are also some issues with this that we need to keep in mind. First, how do we know which set of symptoms we should cluster together as all belonging to the same disorder? In other words, can we define different disorders clearly enough so that we can recognize the specific symptoms that go with each disorder? If we see the symptom of sadness, for example, does this just mean depression, or could this also go with an anxiety disorder or schizophrenia? Second, how do we know when a set of symptoms has crossed the line and turned from a minor problem into something that's considered a disorder that requires treatment? Where's that line? When does shyness turn into social anxiety or sadness into depression? And finally, and maybe this is the biggest issue because it can keep people from seeking help, is all the baggage that goes along with the label of a psychological disorder. Once that label is put upon someone, it can be the first thing that their loved ones see in them from that moment onward. And if you think this is an exaggeration, David Rosenhan studied the effect of a psychological label in 1973 when 8 people had themselves committed to mental hospitals by complaining of hearing voices. This is the stereotypical symptom of schizophrenia. Once they were admitted to the hospital, they acted normally and even tried to get out and persuade the doctors that they were fine. The big question was, how long would it take the expert doctors to see that there was nothing wrong with these 8 people? How long until they would go home? Well, with that label upon them, even the way that they ate their peas was scrutinized for how normal it was, and the last person got out after 59 days. Yes, a label matters, even with trained professionals. Well, we just looked at what's abnormal by first focusing on the huge variability in behavior before examining the 4 Ds as a way to define abnormal behavior. Finally, we discussed 3 issues to keep in mind with diagnosing a psychological disorder. Now, aren't you glad you had 5 minutes?